Right, good afternoon and welcome to today's training on using PSYCKES quality indicator reports. My name is Ashma Thapa and I am part of the medical informatics team, part of the OMH's Office of Population Health and Evaluation. I am also joined by Michelle Rum and Melanie Martucci, who are also part of our medical informatics team, and they will be assisting with the Q&A today. So just some housekeeping things before we get started with the training. We will be using the Q&A feature via WebEx, so all phone lines are muted for today's training, but you may access the Q&A box in the WebEx menu at the bottom right of your screen. If you click on the three horizontal dots and select Q&A option, that should open it for you. You can also type questions using the Q&A feature throughout today's webinar, and by default, that will submit to all panelists so we can all view the questions that are submitted in the Q&A box. Please do not use the chat function as it will not be monitored for any of the questions during today's webinar. So again, all questions can be submitted through the Q&A feature and those will be answered throughout today's webinar. We will also leave time at the end to address some questions on air, and we will have the slides and recording emailed to all the attendees as well after the webinar. And we will also post these slides as well as a recording link to our public website. So here's our agenda for today's webinar. We will begin by going over PSYCKES and transition into quality indicators, followed by demonstration of the MyQI reports feature in PSYCKES using our high utilization indicator set. We will also go over QI trends past year and quality flag sections available to view in the recipient search tab and the clinical summary in PSYCKES. We will then end the webinar with details on additional PSYCKES training as well as technical support. So beginning with the PSYCKES overview, what is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. It is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data and data from other state administrative databases. PSYCKES is designed to support data-driven clinical decision-making, care coordination, and quality improvement, and we will go into more detail about how to do that with the reports within PSYCKES. In PSYCKES, we have ongoing data updates. So the data in the clinical summary is updated on a weekly basis, whereas the quality indicator reports are updated on a monthly basis. So who is viewable in PSYCKES? We do currently have over 12 million individuals viewable in PSYCKES, and it includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment or state psychiatric center inpatient or outpatient services or health home outreach or enrollment. So if a recipient falls within this population, we will provide all data. We have data regarding general medical health, behavioral health, residential, lab, pathology, and many more types. So more about what data is available in PSYCKES. We have the clinical summary, and this will provide up to 5 years of data. As mentioned previously, this is updated on a weekly basis, and this includes all Medicaid fee-for-service claims, managed care encounter data across many different treatment settings. We have medications, medical and behavioral health outpatient and inpatient services, crisis care coordination, among others. We also pulled data from multiple other state administrative databases listed below. And for these, we do have a very quick turnaround, so there is only a 0 to 7 day lag with these data sources. We have data coming in from the New York City Correctional Health Services, New York City Department of Homeless Services, DOH MAP, Managed Care Plan, and HARP status coming in from MC Enrollment Table, State PCEMR, OMH TACT, OMH CARES, NIMERS, New York City Department of Health and Mental Hygiene, as well as any documents such as safety plans and screenings and assessments entered by providers in PSYCKES My Choice. So all of this data that we previously discussed is available in different types of reports in PSYCKES. We have the individual level reports, and that is the clinical summary. Again, that's Medicaid and other state databases treatment history, and that provides up to 5 years worth of data. We also have the provider level reports, and there are four different types of provider level reports. We have the MyQI report, and that will display current performance on all quality indicators. So within these QI reports, you can view the name of the clients who are flagged. If you are a provider level user, you would enable access to get information for that specific client. Similarly, for recipient search, you can run ad hoc reports to identify cohort of interests. You can also look at a list of recipients in different advanced views, which will show you different information that you may be interested in. If you have a provider level access, and this is where access would need to be enabled in order to view the clinical summary information from there. Next, we have the usage reports. So usage reports are helpful as they are used to monitor PHI access by staff. So you can go into the usage report and see who is viewing the client's clinical summary. You can also see who is enabling access and by which type. So for example, if access was enabled by a provider via emergency attestation, or if a client consent was entered, that is something that you can view in the PSYCKES usage reports. We then have the utilization reports, and this is to support providers that have value-based payment data needs. And lastly, we have our statewide reports, and these are very similar to the MyQI reports. Through statewide reports, you can look up a quality indicator and review statewide proportions by provider location, region and county, client residence, region and county, plan, network, and provider, and these are at the aggregate level. So now switching gears to the quality indicators. So what are quality indicators, also known as quality flags? OMH has identified a number of health conditions or treatment issues that are quite important, and what PSYCKES does is that it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, local county or state government leadership can be made aware and take necessary steps. These flags can assist with supporting clinical review as well as quality improvement. The other thing we do regarding quality indicator is we roll up the information as aggregate data in order to provide preference rates at the program level, at the agency level, managed care plan by region or state, and so users can look up preference rates and see where there are opportunities for improvement. And here we have some examples of our quality indicators, such as no diabetes monitoring for individuals with diabetes and schizophrenia, low medication adherence for individuals with schizophrenia, high utilization of inpatient or emergency room services, and eligible for Health Home Plus, no Health Home Plus services in the past 3 months or 12 months. We also have our performance tracking indicators coming from the New York State Department of Health, and these include many of the substance use disorder quality measures. And while the PSYCKES quality improvement report is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6+ month billing data maturation period to allow for service invoicing. The as of date for these measures in the application reflects the most recent performance tracking data run by DOH, and these measures are based on a 12-month period of service. Now let's discuss the MyQI report tab located in PSYCKES. So the MyQI report is a tool of managing quality improvement efforts. So when you log into PSYCKES, you will find two separate tabs for quality improvement measures and performance tracking measures. Again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator. And this is the clients that are served plus other parameters depending on quality indicator specifications. We also will display the number with QI flags, and that will be the numerator. I would like to make a note that each quality indicator measures have their own specifications, and these can differ from flag to flag. So it's really important to refer to our technical specifications document, which can be found on our PSYCKES website, and I will show where to locate these later on in the webinar. So going back to our numerator specifications, these identify the clients who meet criteria for that specific flag. We will also compare prevalence rate for provider agency, region, and state. You can also filter the QI report by program type, client residence, or provider location, region, or county. You also have the ability to drill down into a list of recipients who meet the criteria for a flag. We also have a race and ethnicity view of MyQI report, which we will take a look at in the next few minutes. And you can also export these reports to Excel document or a PDF document. So my QI report will have attributing clients based on a couple of different things. So the first one is billing. Clients are linked to a provider agency if they have been billed by the agency in the past 9 months. We also pull information from DOH MAP, Health Home and Care Management Agency database. So clients that are linked to a provider agency, if they are enrolled in a health home or a care management agency according to MAP, will also be linked to QI reports. And then this rule is used to automatically link the clients to provider so that current clients are included in the report each month. The period of observation for the quality indicator does depend on which measures you're looking for, so it will vary for each of these measures. For example, we have the period of observation for the high utilization indicator at 13 months, so that is a 13-month look back for that specific measure. So this is what my QI report looks like in the application currently. We have the QI report broken into two different sections. On the left, you will see the quality improvement as of November 1st, 2025. And these measures are considered more real time as they are run on a monthly basis. You'll see that we have noted here as well on the actual report. And then on the right, we have our performance tracking measures, and these are run with an intentional lag of 6 or more months. And this is to allow for a complete data to be shown in the application. And these performance tracking measures are not run by PSYCKES, but rather run by Department of Health. And they are taken from measures from NCQA and HEDIS. So these are not PSYCKES dependent necessarily, but we do get that information from DOH that is put into our PSYCKES application. So within QI reports, you can also apply different filters when you are viewing any of the measures. So our filters button is located on the top right of the My QI report screen. And once you select the filters option, you can view all the filters we have available. So you can filter by site, program type, managed care, MC product line, age group, population, if you want to search for all individuals or individuals with complex needs. You can also filter by client resident, so client region and county. Similarly, you can also filter by provider location, such as provider region and county. So for this demonstration, we have the New York City option selected for client region, and then for client county, we have the Bronx selected. And this is the screen after you complete that search. So over here on the top, you can see a list of all the filters that you have selected. So in this instance, we have New York City for client region and then the Bronx for client county. On the top right corner of the screen, you can see the export option. So you can export these tables in a PDF format or an Excel format. So coming down to our quality indicator table, we have the indicator set, the population um, in the set, and then we also have our eligible population slash episode, and this population will be the denominator. And then we have the number of clients who actually met the criteria. And here you can see the comparison between region and state percentage. And then we also have this information displayed in a graph format. So from this indicator set, you can select any of the ones that you would like to view. And when selecting these indicators, if you hover over the text, it will show you the definition of those indicators. For example, when hovering over the high utilization indicator, the definition shows that it is a summary measure indicating the number of unique individuals who meet the criteria for any of the high utilization indicators. So once you select your indicator set, it will bring you to a list of sub-indicators in this specific indicator set. So for the high utilization inpatient/ER indicator set, we have all these specific indicators. So we have 10 plus ER all cause, and these are the list of clients who utilize the emergency room services 10 or more times for all cause. We also have 10 plus ER mental health. We have 2 plus ER behavioral health, 2 plus ER medical, 2 plus ER mental health, 2 plus inpatient behavioral health, 2 plus inpatient medical. We have 2 plus inpatient mental health, 4 plus inpatient/ER mental health, clozapine candidate with 4 plus inpatient ER mental health, and then at the very bottom, we have 2 plus inpatient/2 plus ER summary. And for this demonstration, we will select this specific indicator. So once you select a specific indicator within one of the indicator sets, it will open up several tabs in your MyQI reports. And one of these tabs is the recipients tab. And this will show you the unique number of recipients. This is unduplicated, so each recipient will be will be the list, and when this is unde-identified, you can view their name, their Medicaid ID, their date of birth, race and ethnicity, quality flags, and the current PHI access. As you can see, for these clients, the consent has not been enabled, so you are currently seeing the Enable Access option. So once consent is obtained and enabled in PSYCKES, the recipient name is going to show up in a blue hyperlink, and you will then be able to drill into the client's clinical summary. And again, you are able to export these tables into a PDF and an Excel format. So aside from our recipient tab, we also have different tabs that provide variety of information. For example, if you select our new QI flag or dropped QI flag tabs, you can identify clients who were newly added to your quality improvement list or identify clients who no longer meet that quality measure criteria for your agency. So for these two tabs, you can take a look at the information from the past 1 month or 3 months. Then we also have different recipients tab. For example, if your facility has multiple locations and you would like to generate the recipients list based on those specific sites, you can select the site recipient tab. If you'd like to generate report based on managed care organization, you can select MCO recipient tab. Similarly, if you'd like information on recipients of specific attendings, you can also select the attending recipients tab. And when you go on to export these information, you do have an option to export all of these different tabs, or you can also specifically choose ones that you would like to view. So for example, if I wanted a list of just MCO recipients exported, I can indicate that as the option will be, you will be able to view that option once you select these options. And once you have all these different tabs, in the previous slide, the view that you were currently seeing was the standard view, but you also have the option to adjust to race and ethnicity view. And once you select that option, you can also view the different types of views that we have in this screen. So for this selected standard view, it will display quality indicator prevalence rates for organization compared to region and statewide prevalence rate. And if you select the race and ethnicity view, it will display quality indicator prevalence rate from for clients in different race and ethnicity groups. And you can take a look at this tab if you select the eye next to the view, and it will bring up this information. And once you select the race and ethnicity view, this is what the screen will look like. So the race and ethnicity view displays the percentage and number of clients flagged for each of the quality indicators. And again, this is broken out by different race and ethnicity group, and Medicaid is the data source for this information, so when the race and ethnicity view is applied, it is applied to both numerator and the denominator, and then the percentage is calculated. You can see clients who identified more than one race in their Medicaid registration, and they will be represented by the multiracial group, and clients who identified as Hispanic or Latinx as their ethnicity are represented in Hispanic or Latinx group only. And then for clients whose race was unknown on their Medicaid billing, they are still included in this total category, but they will not be represented in any of these unique breakdowns. So when you take a look at a specific indicator, you can see the breakdown listed here. So, for example, for the percentage for the Asia group, we are seeing 9%. And if you go all the way on the right of the screen, you can actually view the exact breakdown by hovering over this graph. So here you can see the percentage was made up of 8 out of 89. You can also export the race and ethnicity view to PDF in Excel, and it would give you the same exact information that you see in this table right here, but it will exclude the graph. So now I would like to discuss briefly about the QI trends past year. So taking a look at the screen, when you pull up the MyQI report, it is based on the as of date. So all of the information that you currently see in the screen is based on November 1st, 2025. However, let's say if you'd like to take a look at previous month's data or the past year, you will then come to the QI trend past year report and select this option, and it will provide information, QI report information based on the previous months. So when you select that option, it will have your organization's name. You can select different indicator set, and based on those indicator set, you can also select specific indicator. And we also have all these different filters that you can apply, and we also have a graph that will show you the comparison. So we will have the agency percentage and then the region percentage followed by the state percentage. And you can see the date as well. And as you scroll towards the bottom, this is where it will give you all the dates as well as the eligible population for that specific month, including the numbers with QI flags, the percentage of the agency, region percent, and state percent. So as you can see, we have the information for October 1st, September 1st, and it goes back all the way to November 1st, 2024. And going all the way down, we do have a lot of different toggle options where you can save these customized views as well as select different filters. And you are able to export all of this information if you select this toggle right here. So you can export this as an image or a PDF as well as a PowerPoint. So if you select the MyQI reports and select MyQI report, that's going to show you the most current information. But if you were to select QI Trends Pasture, it is going to show you previous information regarding these quality improvements. So now let's switch gears to the recipient search. So previously we discussed ways to view quality flags and quality measures using the QI reports tab, but let's take a look at information on quality flags utilizing the recipient search option. So for recipient search, you can utilize this tab to search for an individual client or generate a list of clients meeting specific criteria that we have listed here. So you can take a look at the characteristics, you can filter using special populations. We definitely have one for quality flags, social determinants of health, service setting categories by specific provider or any provider, as well as medication and diagnosis. So currently, this is what our recipient search tab is what it looks like currently in Psyches. So it is currently broken down into two different tabs. So we have one tab for individual search and we have another tab for cohort search. So for individual search, you can search by the Medicaid ID as well as social security number, but you can also search for a specific client using their first, last name, and date of birth. And if you'd like to narrow your search results, you can also apply the characteristics filter. So you can filter based on age range, race, ethnicity, client region, client county as well. So navigating over to our cohort search, and this is where we have a list of all these different filters that you can apply. So we have characteristics, special population, managed care plan and Medicaid. We have a quality flag. We have social determinants of health. We also have services specific provider. And in the provider name, you'll have your agency listed right here. And whenever you are completing a cohort search, you do have an option to limit the number of results. So when you complete a search, if you would only like a list of 50 clients, you can select that option. But if you'd like to expand that, we definitely have different options for those. So you can select those options as well. So taking a look at our quality flags, it will show the as of date, and then we have our definitions. So when you select this definitions, it will open a PDF document that will provide definitions for all of our quality flags. One thing that I would like to point out regarding our cohort search is that whenever we are applying these filters, we have this logic built in that's or logic or and logic. So whenever we are selecting filters from different criterias or different buckets, that will apply the and logic. But if you are selecting filters from the same category or the same bucket, it's going to include the or logic. And I can go a little bit in more detail in the next few slides. So diving a little bit deeper into our quality flags. So as you can see, you will see our as of date right here, and that is updated on a monthly basis. We have our definitions hyperlink included right here. And for our quality flags, you can search up to 4 different flags per search. So for example, if I wanted to take a look at 2 plus ER mental health and 2 plus ER medical, I can select these two options, or I can select up to 4 different options at a time per search. And I would also like to point out different filters that we have or different categories. So we have our medication and diagnoses, which also includes the as of date. And then we also have services by any provider. And towards the bottom, we also have the limit number of results located here as well. So you can either select that on top of the screen as well as the bottom of the screen. So let's select a few filters and see what the screen will look like. So for this quality flag, we selected 2 plus ER behavioral health or 2 plus ER medical. And as mentioned previously, because we are selecting 2 different quality flags from the same bucket, it is using this or logic. But if you take a look at these 2 different filters, so we have the provider specific, we have the agency name, and then we also selected the social determinants of health filter, problems related to physical environment. And this information is coming from a different bucket. So now the and logic is applied. So if it's from the same category or the same bucket, it utilizes the or logic. If it's from a different category or a different bucket, it utilizes the and logic. So once you select your filters and you select search, This is the table that will show you all of the information. So we will have name, gender, and age, and then followed by Medicaid ID, your date of birth, race and ethnicity. We have managed Medicaid managed care plan, as well as a column for Medicaid quality flags. We also have a column for planning considerations, which I will go over a little bit in more detail in the next few slides. And we also have our current PHI access tab. So right now, a lot of these clients do not have PSYCKES access enabled. So once you select enable access and enter consent and enable consent in PSYCKES, the client's name is going to show up in a blue hyperlink, and that's what you will use in order to drill into the patient's clinical summary. And you can also export this table in a PDF or Excel format. So previously, we briefly discussed different views that we have in our PSYCKES application, and that one was focusing on race and ethnicity view. So for our recipient search advanced views, we do have many different search results view available. So we have the standard view, which was shown in the previous screen. And then we also have care coordination view. So this includes information such as HARP status, HARP, each CBS assessment date, children's waiver status, health home name, care management name, as well as other information such as ACT provider and many more information. And then we also have our high need slash high risk view, and this will include information where we have the OMH unsuccessful discharge, transition age youth, as well as AOT status information, overdose risk, and PSYCKES registries information as well. And all of these will have a column of their own. Then we also have our hospital utilization view. So it includes the number of hospitalizations in the past year broken out by ER and inpatient and behavioral health and medical. And we also have our outpatient providers. So it will display columns that will include information on primary care physician assignment, mental health outpatient provider, medical outpatient provider, substance use outpatient provider, as well as many different information. So depending on the information that you would like to view, you can adjust the view if you go to the top right of the screen. So for this specific one, for the recipient search quality flag, so once you have all of your filters selected, for this client, the consent is enabled. So as you can see, we have the client's name in a blue hyperlink, and the current PHI access shows PSYCKES consent. For other clients, the consent is not currently enabled, but I do wanted to point out the planning consideration column. So this column provides information on service coordination as well as other documents that were uploaded to the client's clinical summary. And for this specific information, no APHI is included in this column. So for these safety plans and other documents that were uploaded, you can view them without having to enable access. So even if a client doesn't have access, you can still view this information in this planning consideration column. So that is one of the other ways that you can visualize Medicaid quality flags for specific clients utilizing the recipient search tab in PSYCKES. So now we will take a look at the clinical summary. So previously we discussed viewing information using the MyQI Reports tab, as well as quality flags filters located in the recipient search. And now we will actually drill into the client's clinical summary and view where the quality flag information is located. So, taking a look at our PSYCKES clinical summary, what is PSYCKES clinical summary? So, this is the patient's information that summarizes up to 5 years of treatment history for a client. and it creates an integrated view from all of the databases available through PSYCKES. For example, hospitalization from Medicaid billing, state PC residential services from state PC EMR, health home information from DOH MAP, suicide risk from incident management, AOT court orders from OMH databases, homelessness information from DHS and Medicaid, as well as many other information. And it summarizes the treatment episodes to support rapid review. And episodes of care linked to detailed dates of services, if needed, are also available to view in the clinical summaries. And this clinical summary is organized by different sections, like an EMR. So, what are some of the information that is included in the clinical summary? So, what are some of the specific sections? So, we have a section on general information, information on current care coordination, notifications, active Medicaid restrictions, alert, social determinants of health, quality flags, psychic registries, plans and documents, behavioral health and medical diagnoses, um, IVOS, care coordination, historical information, medication, so controlled medication or medications for behavioral health or medical health, outpatient services, crisis services, hospital or ER information, dental and vision services, living support and residential treatment, laboratory and pathology, radiology, medical equipment, as well as information on transportation services utilized by the client. So once you drill into the client's clinical summary, if you take a look at the top over here, we have a toggle option between brief overview and the full clinical summary. So a brief overview provides a one-page summary of all of the important information that is included in the full summary. Um, and we also have this data source hyperlink embedded in the clinical summary. And when you select this option, if you take a look at the right, it actually shows you a list of all of the data sources that we have in PSYCKES, as well as the information, where the information is coming from, what that specific information is, as well as the time frame. And you can also download this in a PDF format. Um, and then you can also view this information within the clinical summary itself as well. Another thing that I would like to point out is that on the top corner, the right corner of the screen, we have the data with special protection show and hide option. So right now it is currently selected for the show option, and this is going to include all the specially protected information like HIV status as well as any SUD information. However, if you toggle to the hide option, it is going to hide all of those data with special protection. So we do have an option available for that as well. So this is what the brief overview will look like. And then we are going to toggle to our full summary. But before we do that, I do wanted to point out that when you scroll towards the bottom, we have our active quality flags as of November 1st, 2025. So this is where you'll see a quick summary of all of the active quality flags that the patient currently has. So for this example, we have the general medical health indicator set information, health home care management adult information, as well as high utilization inpatient slash ER. So going on to the actual full summary. So this is going to show all of the information in much more detail. So we have the general section, we have name, date of birth, address, Medicaid ID, as well as all these other information. We also have current care coordination information, as well as different notifications section available on the top. And then when you scroll towards the middle of the clinical summary, we do have a separate section for quality flags. And you can see the as of date and you can see the definitions. So in here, you can see a list of all of the quality flags that the current that the client currently has. So for this one, we have general medical health, health home care management adult, high utilization inpatient slash ER, as well as vital signs dashboard adult as of December 1st, 2024. And this information is coming from DOH map. So for this one, there is the 6 month or there's the intentional lag. So the date as of right now is December 1st, 2024. And when you take a look at these quality flags in detail, all of them are a blue hyperlink. So when you select these specific quality flags, it will show you information regarding these flags in much more detail. And in the clinical summary, you can view this information in a graph format as well as a table format. So when you select the graph format, it is going to show you all of the quality flags listed right here, as well as a time frame of when the client was being flagged for these specific flags. So taking a look at 10 plus ER mental health, this client was being flagged for this particular quality flag from July um, 2022 to January 2024. So this graph provides a visualization on different patterns where individuals and the providers can take a look at this information and make any decisions regarding the treatment as well as coordinate any services. So patterns like these gaps right here, you can discuss these different gaps right here utilizing the graph view that is available in the clinical summary. So once you scroll down to the hospital and ER services, this is where the more detailed information about a specific quality flag will be listed. So if you, from our previous slides, we selected the 2 plus ER medical quality flag, and that provides an information on, or that flags a client based on whether they utilize the hospital slash ER services 2 or more times. So if you take a look at the hospital and ER services, you can take a look at all these different service types. So for this particular example, we do have ER medical listed multiple times. And then you have a list of all the providers as well as the admission state. And then we have our discharge date as well as the last bill date, length of stay, the most recent primary diagnoses, and then procedures per visit. And if you take a look at this button on the right corner of the screen, you can select this to drill further into this specific service type. So if you would like to take a look at the provider as well as more details on the procedures, selecting this button will pull up a more detailed information on services regarding ER medical for this specific provider. And for the hospital ER services, you can also change the view from a table format as well as a graph format. So if a client is being flagged for the high utilization inpatient slash ER services, the hospital slash ER services section can be viewed to look into more detailed information for that specific quality measure. So those were all of the information that we currently have available regarding the quality indicators. And before we move on to the training and technical support, I would like to see if there are any questions that came in the Q&A box.
Hi, Ashma. This is Michelle. We did have one question come in regarding the Health Home Plus eligible measures. Somebody had asked that they see that some of their clients have Health Home Plus, eligible for Health Home Plus measures listed in their clinical summary, but they're not seeing any criteria beyond that section that's indicating that this person is in fact eligible for Health Home Plus services. So they were wondering what they should do for something like that.
Okay, Thank you, Michelle. And that is a really great question. Because the Health Home Plus eligible information is not only coming from the PSYCKES algorithm, but also coming from the DOH map database, sometimes might be some discrepancies around the data that may be coming from DOH map. So the information that is coming from the PSYCKES algorithm is the most recent one. And for this specific instance, we would like the user to reach out to our PSYCHES help desk so we can take a look at the client's clinical summary as well as consult with our data team to see if there are any discrepancies. So that was definitely a very great question. So thank you for asking. But are there any other questions?
Hi, Ashma. I'll ask one question that came in, and this is related to the performance tracking HEDIS measures. So, why are the HEDIS measures displayed differently in psyches? For example, in psyches, I see no follow-up after SUD/ER visit 7 days, but the HEDIS measure shows people that actually have had a follow-up visit.
So that is a really good question. Thank you for asking. So regarding the HEDIS measure, the information that we show in psyches is flipped. So the information that is coming from Department of Health, we flip that measure in psyches to identify improvements. So if a measure in the HEDIS measure shows follow-up for mental health services after ER visits, we flip that information in psyches and we identify information of clients who did not follow up with the mental health services after emergency visits. And this is to identify any room for improvements. So that is one of the ways that we flag the information. So the HEDIS measures that comes into psyches are flipped. So hopefully this answered your question, but if you have any specific questions, please feel free to contact us through our Psyche's help desk. And thank you for asking the question. Are there any other questions?
We have one final question, and this is related to the SUD measures in psyches. And the question is, why am I seeing no recipients in my QI report for the SUD measures?
So for this specific instance, for if a client is not being shown in the QI reports, it could be that the individual may not have been billed as of recently. So the QI reports, the Medicaid information that comes in after the client is billed, then only it links the client to the agency's QI reports. So if the information or if the client has not been billed by Medicaid yet, that linkage may not have happened yet. So that could potentially be a reason why they may not be able to see the client information in the QI reports for performance tracking.
Thank you. And then one follow-up question for that. If we do have bills for the client, but we're still not seeing them, would we need to get consent from the client?
So for the QI report information that is displayed in the QI reports, the information that we currently have is at an aggregate level. So the information we'll have is the client's name, date of birth, Medicaid ID, but in order to actually view the clinical summary, consent is required. So if you take a look at the QI reports table, we have all these aggregate information, but in order to actually drill into a clinical summary and look at more detailed information, client consent is required.
Great, thank you. Those are all the questions we have.
Right, thank you so much, Michelle and Melanie, and thank you for asking all these great questions. So we will move to our training and technical support section. So at the beginning of the webinar, I had mentioned the technical specifications that we have for different quality flags, and because they differ from flag to flag, we have specific documents for these quality measures. So if you go to our public website, which is www.psyches.org, if you take a look at this section on the left side, you will see a tab for quality indicators, and this is where you will find a PDF document of all of our technical specifications document. So for all of the quality measures such as health home care management, quality assurance reporting requirements, hospital readmission, high utilization, preventable hospitalization, general medical health, treatment engagement, and polypharmacy, all of the technical specifications documents are listed here as well. And on our website, this is also a great tab. So if you'd like more information on Psyche's training, and guidebooks available, you can go to our Psyche's training materials tab, as well as any webinars regarding Psyche's will be posted on our Psyche's training webinars tab. But this is the quality indicators technical specifications location page. And if you have more specific questions, we recommend that you reach out to our help desk. So for more Psyches resources, we have our public website listed right here. So we have www.psyches.org. And if you have any questions regarding the Psyches application, or if you would like to take a look into a particular client, please reach out to our help desk. And our help desk is open from 9 a.m. to 5 p.m. Monday to Friday, and our email is psyches-help@omh.ny.gov. And whenever you are trying to log into Psyches, we definitely have different security measures in place, such as the RSA token. So if you are having difficulties with your token or logging into Psyches, we recommend contacting ITS or OMH Help Desk. So for ITS information, and this is for the OMH/state PC employees, you can contact the New York State Help Desk at chat.its.ny.gov, or you can also call them at 844-891-1786. And for OMH Help Desk, if you are a non-OMH or a non-state PC employee, we recommend calling them at 518-474-5554, and you can select option 2 for logging in, as well as token issues, and you can also email them at healthhelp@its.ny.gov. So if you have any questions, please feel free to reach out to us at our Psyches Help Desk. And before we end our webinar, I would like to ask if we have any additional questions that came in.
No, there are no final questions.
All right, that sounds good. So thank you all for attending today's webinar on using Psyche's quality indicator reports, and we will be sending out the slides as well as the recording link. Thank you so much.